advances in arterial and venous revascularization. We have 4 amazing lectures covering the basics and also advanced brilliant techniques to overcome challenging anatomies and lesions. Today's speakers are Dr. Massimiliano Di Primio, Dr. Fabio Corvino, and Dr. Krzysztof Ira.
Only fluoroscopy guidance of the peroneal artery using a 20 gauge needle and using a 0018 wire. As you can see, the wire easily recanalized retrogradely the peroneal artery. And now, once we are in the popliteal artery, what's happening? You can see a very interesting thing in this slide, on the left-hand image. The retrograde wire was in subintimal, and the antegrade wire was intraluminal. Then to do the rendezvous, we need that the both wires are or both in intraluminal or both in subintimal. Because if the wires, they are both in 2 different spaces, the rendezvous will never be feasible.
The catheteries are available in different sizes, and in our case, we use an 8-French one. And as you can see, phlebography demonstrated the presence of thrombus, as you can see here, and we begin to aspirate. This was an example of what we aspirate. And finally, external iliac vein was free from thrombus, but there is a presence of a residual and significant stenosis. Now, what would you have done? I show this case for a reason, because we make a mistake not treating, in this case, this patient. But you learn by making mistakes. This was our first case about 3 years ago.
Once the filter hook is captured equal and opposite traction, counter traction is applied to the snare and shift to disengage the filter from the caval wall. Unfortunately, it's not always so easy like in the pictures over here. So standard filter retrieval techniques typically fail when the filter is significantly tilted. The apex of the filter is embedded in the wall, or the filter struts are incorporated into the wall.
During acute DVT, we use IVUS only in cases we are not sure that we remove all the thrombus, or in case we believe that there is an anatomic, like an May-Turner syndrome or a stenosis, such as the case that I showed.